I'm Don Thibodeau, Doctor of Pharmacy and one of the administrators here at the PharmTec School. I'm excited to be part of this program because I see pharmacy technicians becoming more and more valuable every day, more and more important every day, as we evolve into a more complicated form of delivering pharmacy services with automation and time pressures for volume. It's important to have excellent technical services. That's why pharmacy technicians are being driven up in their level of qualifications and what the level of expectations are.
At PharmTec, we have developed our program to incorporate what we feel is the best mix of all attributes, to provide what we feel is in the student's best interest. We have selected a 4 to 5 month program. This allows students to enter the field in a reasonable time, but isn't too short of a time to risk providing an incomplete education. Other schools also have programs which have multiple entry points. This means that there will be classes where there are students just starting and completing the program. We feel there is a definite starting point to learning pharmacy, which best facilitates not only an initial understanding, but retention of the material. You have to consider, let's look at some of the topics that you're going to be learning as a technician. Okay, there is law. There is something called mechanism of action, which is how does the drug work, because each drug works in a different characteristic way. There's anatomy and physiology, and there is pharmacokinetics, this is a very long word, and pharmacodynamics, and we'll get into what those are in a little bit. And then there's also, there's a lot of things, but there's inventory systems, there is third-party billing, there is, can't forget the drug names, lots and lots of drug names, and therapeutics, obviously, that's what pharmacy is, therapeutics, and there is drug information or drug information resources. Where do you go? Well, that's pretty long. That's going to go off the board. But where do you go to find the correct information that you'll need, especially if you're in a clinical setting and they want to know something? You might spend a lot of time in the Drug Information Center there, or just on your own learning in the other practice sites. So you want to know, but can you imagine if you were trying to, or if you were in a program where there were entry points at different modules, and let's say you entered the program beginning with therapeutics. Well, how can you learn and study therapeutics, which is how drugs treat different disease states and different conditions, without even knowing the names of the drugs or how the drug works, or even before anatomy and physiology to understand therapeutics? So do you see where this would put you at a disadvantage if you were in that type of program? Everybody else might have already had the background info, except for you, because you started right here, thinking, okay, well, they're just, I can take them in any order. You really can't. And a lot of these are this way. You know, pharmacokinetics and pharmacodynamics. This is how the drug affects the body and how the body affects the drug. Well, if you don't understand those, you know, before you know the mechanism of action for each class of drugs, it's really not it's not a good idea. So we definitely do things a specific way. So again, welcome to the program. We put the highest value on technicians, and you'll get to see that pretty quickly. Again, we think you'll enjoy the program. We think you'll enjoy everything, and we make it pretty easy for you, so as long as you're doing your part, everything will be awesome.
The thing that I like best about working in pharmacy is that it's not just some mindless cashiering job where you actually get to think and problem solve. The pay is good.
You see different people every single day, but at the same time, you get the people that come back every month. I'm 9 years later, I am so happy that I took that advice from her and put my foot in the door and became a tech.
I have something that's professional. I take pride in my work. I enjoy it. It's something I get to deal with people, and it takes a lot of hard work, but it's something that you can do and be proud of.
On-the-job training versus taking a course. When I came into pharmacy, I knew nothing about what pharmacy was. I knew nothing about what happened in a pharmacy. Learning on-the-job training was a little difficult. You have no idea what you're getting yourself into. You don't know what any of the medication is, what it does. You don't know, you really don't know much about any of it. My experience with people who have come out of a training course is they're already a step ahead of you. They know what the medication is. They know what it's used for. They can answer the questions when the guests have a question about what their medication is and what it does. Instead of having to go to a computer and look it up or ask the pharmacist, they can sit there and actually tell the guest, this is what it's most commonly used for. On-the-job training they teach you what they want you to know.
Keep in mind, because I imagine pharmacists work with a lot of technicians, sometimes because it's a free program through employee base, the technician choose that program. They're stuck in the future. Why? Mostly the employee-based program are teach you around that institution. They're going to teach you about their location, how their system working. But in the future, if you want to go somewhere else, let's say from retail pharmacy to the hospital, then it is totally new world, okay, for you. That means you don't know nothing.
I did all on-the-job training. They handed me basically a book that said how to be a technician, and I had to take it and study it myself and then get ready for my exam.
You know so much more than what you would just walking into a pharmacy and learning there. They prepare you more for a national certification exam. On-the-job training for a national certification exam doesn't cover anything but what that store offers. So if you're going into retail, you don't know all the hospital pharmacy or infusion rates, and you never deal with any of that.
A lot of factors you have to consider when you choose the school. PharmTec has a trainer who's going to train you, who's going to educate you. They are the pharmacists.
I've worked with lots of other technicians. Someone I work with has their certification, has past experience, and other people I work with came from sort of the same area that I did, where they did all on-the-job training themselves. Students don't understand all of the laws, don't understand all of the insurance issues and problems that go through, and that's an issue. We all have to stop and help them learn where something that they should already know.
My experience with different technicians are that the technicians that have on-the-job training, they're very store specific. It's very much what that store that they got their training at does. Technicians that come from background that went to a PharmTec school, they know what they're doing. They know how to do the job. It makes the pharmacy run more effective, and you're not wasting time.
I'm working on my certification, but again, I'm working on it myself, and I wish I had somebody to kind of guide me along, because I do only know the retail aspect of being a technician, and there's a lot more to that whole world than retail.
Employee-based programs are very limited. They're going to teach you about that setup, their environment, stuck at that particular location. If you go somewhere else, you have to learn again, and you're wasting your time. Time is money. It's not going to help you. So make sure you choose the right school.
And they said that the on-the-job training didn't train them for hospitals and national board tests, and I want to work in the hospital.
One of the pharmacists at PharmTec, I was really shown that there's a lot more out there to getting your certification, and that there are actually pharmacists out there that are going to teach you how to get a well-rounded experience, and so that you can pass your test without going to school, and you can pass it studying on your own, But if you actually get a job in a pharmacy and they're asking for all of these things for a certified technician, and you're like, hold on, I have never experienced this, I have never seen this issue, I have no idea how to dilute something or how to make a compound, and then you're expected to do it. And I mean, you're going to lose your job if you don't get that experience and know how to do it when you start. And somewhere is not going to hire you unless you know what to do, what they're asking of you.
It wasn't until coming in contact with some of the pharmacists from PharmTec that I realized the benefit of being at a pharmacy tech school and how much it's going to give you that well-rounded education. It's going to prepare you for being in that professional setting and to make your job easier.
I talked to countless schools, and PharmTec was the one that felt like they matched up with me when we talked on the phone. Well, when I talked to PharmTec, I thought they were in my best interest and wanted to help me and see me succeed.
Like PharmTec, the instructor who are the pharmacists, you're going to get the full entire program even, and the good thing is the cost is so low.
People who are going online looking at different schools, you definitely need to do your research.
I was looking for a school out there. I mean, I would definitely check on the price. I was going to want to make sure that you're learning from somebody who's also knowledgeable in the field and that has experience, because you can get told everything from a textbook, but when you actually get out there, I mean, it's different. I mean, everybody has a different problem. Every insurance is a different issue. Everybody takes different kinds of medication that all interacts different, and you kind of have to know what you're looking for and all the different situations you're going to come across. You also want to make sure that it's somewhere that's registered with your state of pharmacy, because there are places that you can go through all your classes and then you find out that you can't get registered because you've been taking exams that kind of don't count.
If you're looking for a pharmacy tech school, consider PharmTec. Consider the education you're going to get. Consider who's teaching the courses. Consider the length of the course versus the cost of the course and what you're going to get here at PharmTec.
So we hope you'll choose the PharmTec School as your pharmacy solution, because we're looking forward to building a relationship with you.